Is a fantastic volunteer for Resolve of New England. She's also on the board of Resolve National and is just a fantastic advocate for infertility and is actively involved in everything that is going on from an advocacy perspective. Without further ado, here's Lee Rubin Collins. Thank you.
Thank you, Erin, and thank you everyone for coming here today to Resolve of New England's annual conference. It's really great to see so many supporters of this important organization. So I am going to be wearing two hats today, one as an advocacy volunteer for Resolve of New England, and then second as a board member and co-chair of the Advocacy Committee for National Resolve. Let me start with local Resolve because I have some really important and exciting advocacy news to share. I hope everyone here knows that last year we were able to have the legislature pass an historic improvement to the infertility insurance mandate in Massachusetts. Dr. Samuel Pang and I actually drafted the language for the improvement to the mandate, and through a real team effort, doctors, mental health professionals, and volunteers from Resolve of New England, we met with state senators and representatives in just dozens and dozens of meetings, and we were able to get this historic improvement to the Massachusetts mandate passed. So that now, if a patient is over age 35, she and her husband only need to try for 6 months to conceive before they qualify for infertility coverage. It used to be a year. And you can imagine with 40-year-olds, waiting a whole year of trying to conceive could be the difference between ever having a family or not. And second, we were able to close the miscarriage loophole so that patients who have a miscarriage are not pitched right back to the beginning of the 6-month or the 12-month qualification period. We have been so excited. We've talked to doctors and to clinics that they are now able to treat more patients because of this improvement to the mandate. And indeed, when I was at the ASRM conference a couple of years ago, several people told me that patient volume is down all over the country, except in Massachusetts. That's what they were hearing. But the thing about passing this new law is that it's not self-executing. Regulations have to be written in the Code of Mass Regs to implement this new law and to tell the insurance companies how they're supposed to behave. And so the Division of Insurance announced that it was convening a series of informal meetings. And we found out about them, and Erin Lasker, the executive director of Resolve in New England, and I attended 2 meetings in May and June of this year. Let me tell you who was at that meeting. It was representatives of the Division of Insurance, and then representatives of every major insurance company. And there we were in the room with them. This was groundbreaking. We have not had an opportunity to meet with insurance companies in a group like that in, I'm going to say, forever. And I need to shout out Dr. Mark Hornstein and Dr. Kim Thornton, who came to the second of the 2 meetings and made a tremendous contribution to the dialogue. Among the things that we have proposed for the regulations are that it is refining when a woman is over age 35 for purposes of the shortened qualification waiting period. And we have proposed, and we think this may take, that if a woman is 35 years and 1 day, she is over age 35, rather than having to wait until she's age 36 to get the benefit of the 6-month shortened waiting period. We have proposed providing coverage for imminent infertility in the case of cancer patients and other patients who are facing treatments that are going to rob them of their fertility. And finally, we have challenged the massive exclusion of patients from treatment based on their FSH or Clomid challenge test results. And we've actually proposed a really innovative way of doing this kind of screening in a way that will stop what we consider to be the arbitrary exclusion of patients based on unproven scientific data. We have an empirically based new formula for how to treat FSH testing. So we're very excited. These were incredibly productive talks, and I just feel so proud of Resolve of New England for participating very, very aggressively in these meetings with the Division of Insurance. Besides that, when it comes to local things, it's actually been a quiet legislative session. There are two bills that have come on the radar screen. One is to make a further addition to the Massachusetts insurance mandate to include people who have diagnosed genetic disorders. We think this is a laudable bill, but the word that we're hearing is that after the big change that we were able to get last year, this one probably is not likely to pass. The other piece of legislation is that one state representative introduced a bill that would allow people to go to the probate courts to adopt an embryo. And this is something that we feel is quite unnecessary and is a step in the direction of treating embryos like children to be adopted. And so we have submitted a letter opposing that. We're hearing from the committee that the bill is not going to go anywhere. So we also sent a letter in support of the genetic testing bill. So we're keeping an eye on these things, but don't expect much to happen in that sphere this year.